It's now my pleasure to introduce Paul Flynn, Chief Executive Officer of the Hospital Research and the Road Home.
Honourable John Dawkins, MLC, Premier's Advocate for Suicide Prevention, representing the Premier of South Australia, Commissioner Chris Burns, CSC, SA Mental Health Commissioner, Principal Chaplain Colin Acton, the Director General Chaplain of the Royal Australian Navy, representing the Chief of Navy, Group Captain Greg Waller, Director of Community Engagement, Royal Australian Air Force, representing Air Commodore Philip Gordon, Commander Andrew Bennett, ADC RAN, Commanding Officer, Navy Headquarters, South Australia, Michael Morgan, Chief Officer of the South Australian Metropolitan Fire Service and also a Road Home Board of Governor, Professor Roger Eston, Pro-Vice-Chancellor, Division of Health Sciences, University of South Australia, international and Australian presenters, delegates, families and friends, good afternoon and thank you for joining us at the Global Alliance Conference on Post-Traumatic Stress, presented by the Road Home and the Australian Centre of Excellence for Post-Traumatic Stress. I'd like to acknowledge the Foundation partners and exhibitors, the Mental Health Commission of South Australia, the University of South Australia, the Police Association of South Australia, Open Arms Veterans and Families Counselling, and Operation K9 at the Royal Society of the Blind Assistance Dog Program. Without your support, we could not bring this inaugural event to South Australia and provide the opportunity for so many of the world's experts to come together in one location. Thank you all, whether speaker or delegate, for joining us this week from Australia, New Zealand, United Kingdom, Ireland, Canada and the United States. Your commitment to all servicemen and servicewomen, first responders and their families around the world is making an impact in people's lives. The Road Home, a charity of the Hospital Research Foundation Group, independently funds research and programs to support the health and well-being of those individuals who have presented themselves willingly and selflessly to serve our communities and our countries. Those veterans and first responders and their families whose service is sometimes taken for granted are owed a great debt of thanks, but more importantly, we owe them our very best efforts to ensure their improved health and well-being is always our first consideration. The Road Home and the Australian Centre of Excellence in Post-Traumatic Stress wants to continue to strive to support innovative research that aims to deliver on our commitment to serve those that have been damaged while serving us. Since 1995, the Road Home, formerly Foundation Door Park, and the REPAT Foundation here in South Australia has had an unwavering commitment to building a community of collaboration in both research and research-backed programs. This Global Alliance Conference is a testament to that vision. As I look around the room, I feel very proud to be able to host this event in Adelaide, bringing together leading researchers, practitioners, program facilitators and inspirational peers who will share their learnings and wisdom to enable us to find new ways to connect and build on this alliance. It's a very exciting time for the Road Home. Not only are we happy to be welcoming you all here, we also recently announced the appointment of our first Director of Research, Dr. Miranda van Hoof, who's with us today. Miranda brings extensive experience to the role. She'll present today on combat, transition, first responders and families, the Australian context, together with Dr. Ellie Lawrence-Wood and Dr. Galina Daraganova later this afternoon. Welcome, Miranda. As part of the Hospital Research Foundation Group, which is the largest non-government funder of medical research in South Australia, the Road Home is a key plank in a bold strategy that's focused on the power of collaboration. The Hospital Research Foundation is unique in that we fight against more than 40 different types of research, areas of research and patient care, from pregnancy to palliative care and everything in between, all in South Australian public hospitals. Last year, we provided grants in excess of $24 million to research and patient care activities, and those initiatives are aimed at finding cures and improving care. And this year, we're looking similar, if not a little bit higher. In June this year, we launched a campaign called Together Fight. You may have noticed, I hope, the pins on your table, which are there for you to take away. We've been calling on the community to join us in the fight for the health and well-being of our loved ones. Today, I call on you to join with us in the fight for better treatments and improved care in hospitals, the fight to prevent disease and win the battle with mental health, and the fight to advance medical research faster to achieve these things sooner. On behalf of all at the Road Home and the Hospital Research Foundation, I welcome you all here. We wish you a very successful conference, and as Helen Keller said, alone we can do so little, together we can do so much. Thank you.
Right now, I'd like to introduce SA Mental Health Commissioner Chris Burns, who's going to say a few words. Chris Burns.
Can I echo the acknowledgement of the traditional custodians of the land we meet on today, and also echo Paul's acknowledgement of the dignitaries that are here today. But can I also acknowledge those in the room with lived experience of mental health distress? Now, normally when I say that, I see these heads moving around and looking around saying, I wonder who that is. 45% of Australians will experience a diagnosable mental illness in the course of their life. If you extrapolate Chris Burns' mathematics out of that, 55% of Australians will care for someone who is experiencing a diagnosable mental illness in their life. So everyone in this room has their own lived experience with mental illness and mental distress. That's why it's so important that we gather for events such as this. The South Australian Government, through the Mental Health Commission, is extremely proud to be here as a foundation partner and to partner with the Road Home and University of South Australia in delivering this Global Alliance Conference on Post-Traumatic Stress. The one thing that we have learnt in developing a strategic plan for mental health and wellbeing in South Australia is that we are deficient in research. And opportunities like this to hear what experts on mental health and wellbeing and post-traumatic stress have learnt through their research and are offering back, not just from here in South Australia, but from throughout Australia, and most importantly throughout the world, is a unique opportunity and one that we are very, very keen to support. Our vision for South Australia is that we are an internationally recognised, resilient, compassionate and connected community that is strengthening the mental health and wellbeing of all the South Australians. And the end effect of that is we will grow our mental wealth. And South Australia will be a great state of mind. I hope those who are visiting enjoy the conference, but also enjoy their time in South Australia. And from those here in South Australia, please enjoy, listen, and let's keep the lessons here and grow our research to help those who experience post-traumatic stress in our society. Thank you.